Doctor, why do I go in period with too much pain, diarrhea, vomiting, and energy loss? Charampa asked. In this video, I'm going to address two things. One, pain alone. And I'm also going to address something called the premenstrual syndrome. Now, some people experience something called the premenstrual syndrome, which can, in its severe form, be called the premenstrual disorder. You experience from as slight as just mood changes to severe forms as a lot of pain and vomiting, diarrhea, lack of sleep. Okay? Now, that's called the premenstrual syndrome. Okay? There are a lot of things that cause the premenstrual syndrome. For some people, it's genetic. So, one of the questions that I would like to pose, if you're experiencing this, is it something that you started with right away when you started your period as a young girl of 13, 15, 14? Or is it something that came up later in life when you got to 17? Or when you got to 25? It might be something new. If it is something new, it generally means that you might have a condition called endometriosis. Endometriosis basically is when that layer inside your uterus, the uterus is made up of 3 layers. The outer covering, which is like a polythene bag-like, the middle covering or the middle layer, which is the bulk or the meat of the uterus or the muscle, which is called the myometrium, and then the inside layer that usually bleeds every month when you go into your period, and that is called the endometrium. Now, that layer that bleeds, sometimes the contents of that layer or the makeup of that layer can be found outside the uterus. Okay? And it's this content that also receives hormones every month and bleeds. But unlike the layer inside the uterus, which when it bleeds the blood goes out of a woman, in endometriosis the blood does not get out. It doesn't have a way out. It doesn't pass through the vagina and you see it on your pad. Rather, it stays in the area, okay, where it has been deposited. It causes a bit of corrosion and tissue damage and it gives you extra pain. This bleeding usually coincides with the bleeding of the month. And if it coincides, then it's likely to make your pain so severe. Some people feel pain as far as the navel. They feel pain in the thigh. They feel pain in the bums. Depending on where the deposits are, you might feel a lot of pain. This is called endometriosis, and it's important to investigate it, stage it, and manage it. Okay? Now, Charampa said she feels too much pain, diarrhea, vomiting, energy loss. Let me come to the premenstrual syndrome. The premenstrual syndrome can be worsened by endometriosis, one we just talked about previously. But for some people, it's a genetic thing. You were born with it. You started having your periods and you started right away with having a lot of pain, with having diarrhea, with vomiting and energy loss. Okay? Is it manageable? Yes. It's treatable. When you visit a gynecologist, okay, the gynecologist can suggest treatment from as low as just diet change, what you eat, removing caffeine from your diet and taking a lot of hot water, to as high as surgery, okay? But in many cases, people fit in within physical exercise, dietary modification, and a bit of use of NSAID such as ibuprofen. Okay? Some people's pain is controlled. The mood is better as soon as they use an NSAID such as ibuprofen. But for some people, they need so much. They can't even go to work depending on how bad the pain is. Are you among those? Visit a gynecologist. Ask, what can I do for my condition? The gynecologist will take detailed history, might even ask for investigations if so necessary, and will suggest appropriate treatment. There are home-based remedies that you can use. Okay? For example, when you're about to get to your period, you start using a warm compress. Hot water, put in a cloth-like thing or gauze and put it below the navel. Okay, put it below the navel, hold for around 1 to 2 minutes, then repeat. Okay, you do it in the morning, afternoon, evening. It might help with your symptoms. Okay, as for the mood swings, some people require to even see a psychiatrist. See a gynecologist first. They might recommend that you see a psychiatrist to help you with managing your condition. The mood swings, the feeling of uneasiness. So, yes, Charampa, you might have endometriosis, which needs to be diagnosed and managed. But you might also just have what is called premenstrual syndrome in its severe forms, which both can be managed. Visit your gynecologist, okay? And they will have answers for your questions. Right, this is the Good Gyne. I am going to be answering many of your questions here. Don't forget to follow me. Don't forget to subscribe to my YouTube channel. And sometimes I don't have so many answers right away, but I will try to answer your questions as much as possible.